I'm a medical oncologist and I work in the Division of Oncology in Rambam Medical Center in Haifa, Israel. I started my lab in 2012 and since 2013 I've been funded by the ICRF constantly until nowadays. Well, my research on ovarian cancer focuses on prevention of ovarian cancer in women that are BRCA1 and 2 mutation carriers, women which are at high risk for ovarian cancer. When I finished high school, I knew I wanted to be a doctor, and I had one friend whose mother was a physician, and I asked her to take me to a day at work. And she was a medical oncologist, and I went with her to work, and I was really, really impressed by what she did, the connection she has with her patients. A medical oncologist and a patient is a very, very special relationship. It's a very deep relationship. Another reason why I like being an oncologist, which I didn't know at the time, is the innovation. I think there's no field with so much advancement, so much research, so much new treatment like oncology. As a physician, at some point, the work becomes routine. In research, there's no routine. There's always new questions, there's always new methods, there's always new results that are difficult to understand and you need to find an interpretation for. The fact that I can't cure them, the fact that I know that all patients, or almost all patients that come through my door will eventually succumb to their disease, makes me very, very motivated to work in the lab and find new ways to prevent cancer, find new treatments for cancer. So a woman that comes either to my office in 20 years or to my daughter's office in 40 years will not have to go through what my patients are going through today. Getting funded has the biggest impact possible. So knowing that you have funding for the next 3 years gives me a lot of peace of mind, knowing that the research can continue, the people will still have their jobs, and results will be achieved. Can't imagine my life without the support of the ICRF. It is so difficult to get funding. If there was no ICRF that I can count on, I couldn't have slept at night being worried about the funding of the lab. Maybe I wouldn't even have my lab. So thanks to the support of the ICRF, I can have my lab, I can run my lab, and when I have an idea that I think is great, that will be the next thing in cancer research, I can actually get it done.